On this finally fabulous, beautiful, sunny day, which we've long awaited for. I recognize many of you, but some of you I don't know. My name is Sue Pfister, Director here of the Westport Center for Senior Activities. And this afternoon, I'm honored and pleased to introduce Congressman Jim Himes. Does anyone know why he's here?
Yeah. I know. He came for the free lunch.
Even I need to learn about this health care reform. So I'm looking forward to your speech this afternoon so that I too can get educated, because I know you all have a lot of questions as well. I thought what we do is respect Congressman Himes' speech, let him go over the plan, and then if we can just hold your questions to the end. We are getting a little bit late of a start, but Congressman Jim Himes is willing to stay a little bit after, so don't panic about the 3 o'clock deadline. And I believe his staff is passing out some handouts, so we'll try to do that while you're talking, if that's okay? Great. Thank you so much.
Thank you. Well, thank you, everybody. I really appreciate you coming here today. The topic of the discussion is the health care reform, and in particular, how it affects our seniors. And I'm really excited to have this conversation with you, because over the course of the long and at times angry debate on health care, if there was one area where there was a particularly egregious amount of misinformation, it was with respect to how our seniors would be treated here. What I propose to do is, I'd like to walk you quickly through the changes. I'm looking around at the room, I'm thinking most of you are probably Medicare recipients, not all. But I will start with how the health care reform will, in the immediate term and in the coming years, affect our seniors. And then I'm very happy to have a much more broad-ranging discussion about the health care reform, its finances, its economics, how it affects the deficit. But let's start with how this affects the seniors. Happy to take questions on that, and then I'm happy once we get through that to talk about anything you'd like. And frankly, if you want to talk about things other than the health care reform, we've got other issues too, and I'd be delighted to take your questions on Afghanistan, Wall Street, whatever's on your mind, if we have time to do that. Let me start by saying that, as I said before, seniors were subject to an awful lot of misinformation from the moment that this health care reform was contemplated. Sarah Palin came right out and floated the concept of death panels, which had absolutely no bearing in anyone's version of reality. And subsequently, there's been a more grounded concern about some of the efficiencies that are being found in the Medicare system, that could compromise the Medicare that you know and probably love. When I'm in a group of seniors, and I've been in front of a lot of seniors, and I ask how many people like their Medicare, 9 out of 10 hands go up. So I want to address that very specifically, but I want to start with how this reform will affect you right now and in the coming years. The health care reform bill, which is now done, will affect you in the next couple of years in a couple of important respects, and I'm going to focus on the benefits, and then we can talk about concerns that you have. Starting right away, 2 things happen that don't affect seniors. A 35% tax credit for small businesses that choose to cover their employees, and 26-year-olds being allowed, up to 26, to stay on their parents' insurance. Very shortly, seniors will be affected in a couple of ways. One, there will be a $250 credit. It's a start against doing what this bill will do over a period of 10 years, which is to close the Medicare donut hole. And I know that donut hole affects some of you. It doesn't affect all seniors. Sometimes you don't get across that spending threshold on your drugs, but once you get across that threshold, as you know, you start to go out of pocket, up to thousands of dollars. And so over a 10-year period, that several $1,000s that previously you were called on to pay goes away. It starts immediately with a $250 credit if you find yourself in that donut hole. The other thing that comes in the next month or two that will affect you if you are in that donut hole is that the pharmaceutical companies have agreed that any brand name drug that is purchased by a senior who is in that donut hole will be subject to a 50% discount. So if you're on a brand name pharmaceutical and you're in that donut hole, the cost of that drug will go down by 50%, starting pretty much immediately. Over the course of that next 10 years, through to 2020, that donut hole will close. So each year you will see that $250 rebate that you get back if you're in a donut hole increase in size until 2020, when there will be no more donut hole. This was something that seniors, and some seniors are wealthier than others, particularly those seniors scraping to get by on fixed incomes, really made a point to talk about in Congress. Now, there's another area of benefits that kick in soon this year that you need to know about. You will no longer be asked to pay copays for preventive care. As you know, right now, Medicare covers that first physician's visit, that physical, but after that first physical, Medicare does not cover your annual physical. From now on, that physical will be free to you. And I'm careful to talk about this sensibly. Nothing is free. The system will pay for it. The Medicare system will pay for that physical. But you will no longer be asked to pay for it. You will no longer be asked to pay for other forms of preventive care. Colonoscopies, mammography, other procedures and visits that are designed to be preventive and primary in nature will no longer be subject to either payment on your part or to copayment on your part. This is a good thing for our seniors who sometimes don't have the money to pay it. And it's also a good thing economically for the system, because if we can catch things early through a mammogram, through a colonoscopy, it is much more economically efficient to deal with those things early than it is to deal with them later. Not to mention the tragedy that comes when you catch something very serious later rather than earlier. So those are really the two big changes that you will experience. Now, there has been concern that because the Medicare system is providing a little less than half of the revenue for the reform, that this will result in a decrease in your experience or a decrease in your services. And I want to say two things about that, both of which I would argue suggest that that is not true. The first thing is that the Medicare system, as you know, is not a model of efficiency. There is fraud, there is waste, everybody has a story. Some of them are truly outrageous. And this reform puts in place mechanisms that will not allow doctors to double bill, and by no means all doctors double bill, but some of them do, that will really introduce some accountability into the system. That saves us a little money, not a lot. We also save money by reducing the taxpayer dollar subsidies that for years now we have been sending to the health insurance companies to entice them into the Medicare Advantage program. Some of you will have Medicare Advantage, and if you know the history, you know that billions of dollars go every year of your taxpayer money to the health insurance companies to subsidize their participation in the Medicare Advantage programs. Those subsidies were supposed to fade. When Medicare Advantage was developed, the idea was, let's bring them in, create a private sector competitor to the traditional Medicare system, and to do that for a few years, we will provide some subsidies. Well, a few years of subsidies turned into permanent subsidies, and those subsidies will be pulled away from the Medicare Advantage providers. If you are on a Medicare Advantage program, you should talk to your Advantage provider on what that will mean for your program, but it will not mean a meaningful decrease in your services. That's the first thing I want to say. The second thing I want to say, which depending on what you think of the AARP, and I know that there's probably diverse opinions in the room on the AARP, I spend a lot of time with them, and I know that they are probably the nation's most aggressive advocate on behalf of seniors and on behalf of the integrity and the quality of the Medicare program. And the AARP endorsed enthusiastically this reform. They never in a million years would have done that if they thought that there was any risk that this would result in a decline in the quality of the care going to our seniors through the Medicare program. There are some pages coming around right now that have more specifics around the changes that will affect Medicare.